keep it brief today, hit on our current status of COVID infection rates in the county, which continues to improve, and also talk about major progress in our vaccination efforts. So also reason to be encouraged and positive. We have a lot more work to do there, but we are making great headway, and this week got a much greater supply, so I'll talk about that in a moment. Before I start on COVID, I do want to briefly talk about the weather impacts from last night and this morning's high wind weather and storm that hit the area. I know many out there are still without power, including my wife and I woke up this morning and our son with a pretty cold house. Many folks throughout the county, over 10,000 households, did lose power last night in the middle of the night. As of 9 a.m. this morning, the Central Hudson crews had got that down to 7,300 without power. And then as of right now, they've continued to work throughout the day, and we're now down to a little over 4,000 without power. So I want to thank the Central Hudson teams that are out there, several hundred of their linemen and other workers doing that work. They're aiming, of course, to get everybody back up as soon as you can. If you are without power and are having issues with weather or other needs, please, you can reach out to our Recovery Service Center, 443-8888. We do have our Ulster County Warming Center is activated, so if you need a warm place, please do reach out and we can get you linked up there. And if you have any other needs, of course, you can always call that number as well. Diving into the COVID situation, we have cumulative total cases now of just under 11,000 in Ulster County, 10,981 to be exact. Over 280,000 total tests administered at this point, and we continue to have robust testing, diagnostic testing, and now increasing our rapid testing capacity. We've had 9,260 recover, and unfortunately, we do continue to lose loved ones and colleagues and neighbors and friends to COVID. We're now at 233 of our Ulster County community members lost to COVID. That has finally started to slow down, but obviously any more loss is unacceptable, and we're doing everything that we can to address that between our precautions as well as our vaccination effort. Looking at the hospitalizations, this is positive news here. You can see now on the graph a consistent, much lower level of hospitalization. We're currently at 9 hospitalized in the county, with 0 in ICU beds or on ventilators. Looking at the total active case count in the county, once again, a clear trend here on the graph. We are continuing to see the numbers recede from the second wave, and we are trending in the right direction, but we still have 1,488 active cases, which still puts us, just for comparison point, at a higher level than even the peak of the first wave. So we still have work to do here, and if we don't continue to get that infection rate down, things could go back up, which is obviously not what we want and what we need at this moment. Part of the reason that we're still, that we are positive about the direction of the situation, but still concerned and watching carefully, is that the new infection rate continues to hover somewhere around or just below 5%, which is much, much too high. Our exact new infection rate for the last 96 hours, the average is 4.69%. In the last 4 days, we tested 4,283 individuals and had 201 new positives. Once again, 201 new positives out of 4,283 tested over a 4-day period. That gives us an average positivity rate of 4.69%. If you remember from a just overall kind of contextual perspective, back in the summer when we were at or below 1%, we and our health commissioner and health experts feel like that is a sustainable level of risk and a slow enough spread that it's not great risk. Anywhere above 1, 2, 3, and now we're still almost at 5% is too high. It means there is still COVID spread, and we have to continue to take all the precautions that we've been doing for nearly a year now but which we know work, and we're going to have to continue to do that for many months as we see our vaccine effort ramp up, hopefully very quickly here. Looking at the long-term trends for COVID in the county, you can see the projections here of best, most likely, worst case. With that infection rate still hovering around 5, we're closer to that yellow line, and I continue to urge and encourage everyone to continue to take this, the pandemic seriously, and not let our guard down in the midst of, we are seeing progress and we're seeing more vaccines, but that is not a reason or an excuse to not continue to do all the things that we need to do there. Hospital capacity looking forward, we are in very good shape here. Again, 9 currently hospitalized and more than sufficient near-term, medium-term, long-term need there. Please, again, I know it's been a long year. We are approaching March 8th was the first positive case in Ulster County, and just the other day we had the one-year mark of the first case in New York State, the first known case in New York State. So I know we've been at this for almost a year, but it's just absolutely critical that we continue to keep this in check. We've seen small numbers of new variants in the state. We've even seen one confirmed case of the UK variant in Ulster County, which we know could be at higher risk of spread. The last thing that we want is to allow the infection rates to come back up just at the time when we're very close to getting wider availability of the vaccine. So please, 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 yourself and your loved ones and anyone you're talking to, encourage them to continue to wear masks, maintain social distancing, avoid those gatherings, and please continue to wash hands and use hand sanitizer. Sorry, I needed a water break there. Shifting gears to our vaccine efforts, I think this is by far the best, other than the fact that the fact of the vaccine being approved and developed, of course, in terms of the vaccine distribution and supply, this is the best news that we've had yet since we first started receiving doses. This week in Ulster County, we saw an almost quadrupling of our supply that we're receiving from New York State. Ulster County this week has been allocated just over 7,000 doses, 7,040 to be exact. And again, last week and several weeks prior, we were under 2,000 doses. We were right around 1,900 doses we had been allocated. So this is a big deal. It's very encouraging news. Again, it's not nearly enough, and I'll talk more about that in a moment. But to see our supply quadruple in this week, it is a direct result, I believe, and we believe, of, frankly, the Biden administration coming in and addressing some of the inefficiencies in the previous system, working with Pfizer and Moderna to scale up their production, as well as now we're just, of course, saw over the weekend Johnson & Johnson be approved, and we will start to see some of those doses later this week and more of them next week here in the county. So all of those factors coming together is why we're finally starting to see significantly more supply. And I've said from the beginning, our capacity to give and distribute is very high. It was the supply that was holding us back. So I'm very optimistic now that we're starting to see the supply pick up. And we here in the county are very much ready to accept that supply and as much as we can get from the state as soon as we can get it. To give a little bit of more specifics on the additional allocation this week, our Ulster County Health Department specifically was allocated 3,340 doses this week. That represents nearly 5 times what our health department got the week prior. And I wanted to be clear and be specific with you all as always. This additional supply, the preponderance of this additional supply we're getting for the state has directed that the vast majority of that has to go to seniors 65 plus. So I know folks in seeing additional supply, of course, are eager to take advantage of that, whether you're a senior or an essential worker or any of the other eligible categories. But I did want to make clear that New York State, based on the greater health risk to seniors, has directed and required that the large preponderance of those additional doses that we're getting must go to seniors over the age of 65. As more supply becomes available in the coming weeks, I'm sure that will adjust and we'll be able to get more vaccine to every category. But I did want to be clear about that. I'm sure folks will have questions about that or had questions about that. Here's a further breakdown within the existing categories of how those have been allocated. Once again, the allocation that we get here in the county is directed by New York State. So we get what we get, and we do our part to get it out to those that we're able to get it out to. Those in Phase 1A, which are healthcare workers, this week we actually didn't get any additional doses. That means there's still some left from last week to finish up the remaining healthcare workers in the county. Based on the numbers that the state has shared with us, we are over 90% of healthcare workers that are eligible have been vaccinated at this point, which is really remarkable and a credit to everybody doing that work. So to get those folks that are in the front lines at the greatest risk, almost all vaccinated, is very good news. The 1B category, these are our essential workers, first responders, teachers, and so on. We were allocated 700 doses this week. Those will all be administered by our Ulster County pod sites in Kingston and Ellenville. We are also making really good progress with this group. In particular, I know many, both teachers and parents, are focused on how we're doing with getting our teachers vaccinated. We are, I think, on track to have all teachers that are eligible vaccinated in the next few weeks, if not sooner. So that puts us in a very good position, assuming things stay the same with the overall COVID situation, to be able to get back to some sense of normalcy in schools. We'll obviously keep you updated there. We're working very closely and very well with all of the superintendents and school leaders to be communicating around that. And then, as you can see on the slide here, seniors are getting the vast preponderance of those additional doses this week, 6,340 doses. Those will be distributed by a whole host of different folks, and I'll talk about that here on the next slide. But boy, I have to say, just seeing that number, saying that number, is a totally different magnitude of supply that we finally have, and that feels really, really good to know that we have more coming, that in the next week, thousands now of county residents, those at the greatest risk, are going to be vaccinated. And I think this represents a significant inflection point where we'll hopefully just see this continue to build and expand in terms of supply. Here's a little bit more information about where those vaccines will be distributed and when. Once again, the way that it's happening in the state, there are multiple different entities involved here. We have some county-run and county-led pods, and then there are also other partners that are distributing. So I'll talk about that as well and share that on the slide. For those 3,000 plus county doses, we're going to be running 4 different distribution clinics starting tomorrow through Saturday. On Wednesday, we'll be at the Ellenville High School. Thursday, we'll be at the SUNY Ulster campus in Stone Ridge. And then Friday and Saturday, we'll be using our Kingston High School Fieldhouse pod location. We're making sure in using all of these sites that we're really doing our best to have equal access throughout the county, but still make sure we have facilities that are big enough that we can handle the number of folks. We'll be doing hundreds of folks at each of those county-led pods. And then in addition, there were several hundred doses allocated to other provider partners. You can see those 4 there, the Family Health Center in Kingston, 2 Walgreens locations. They each, in Kingston and Highline, got 100 doses. And then Neil Smoller and team at Village Apothecary that have been doing and continue to do great work, got a significant allocation this week as well. And I know he's working and his team throughout the county. So I'll talk more about this shortly, but if you're watching now and feeling positive like I am that we have more, I'm sure you're asking, okay, what do I need to do to make sure myself or my loved one are able to be vaccinated? The short answer is you need to get on our pre-registration list, which we have several, almost 30,000 people, or excuse me, over 30,000 people are already on that list. There are two ways to do that. You can go to VACCINATEUlster.com, VACCINATEUlster.com. You sign up on the pre-registration list. If you've already done that, you don't need to do it again, and you should be getting our emails. If you're not, you can reach out to us, or you can go and sign up again. If you're not able to get online, you can call our Recovery Service Center. We have great members of our team standing by. That number is 845-443-8888. Once again, 443-8888. So what does this all mean in the big picture? How are we doing in terms of our overall vaccination efforts? Remember, we're about 2 to 3 months into this now. We know that early on there was really a very slow trickle of supply. As Dr. Tack talked about, if any of you joined us for our town hall, he thinks of this as sort of a faucet, which I think is a really great analogy. And as we started to get vaccine, it was really just a drip, a very slow drip of the faucet. We're starting to do everything we can to turn that faucet and open up the supply, get that flowing at a faster volume. And so now, almost 3 months in, as we've been all doing our part to open the faucet, I did want to share the progress county level data. This is provided by New York State, but this is specific to Ulster County. We are continuing to make really good progress. We've had, as you can see on the slide here now, over 26,000 residents have received at least their first dose, and over 13,000 have gotten their second dose. Obviously, everybody that's gotten their first dose will be getting their second dose as well. So we've now had just shy of 15% of our total population be vaccinated. Last week we were in the 12, so we are making headway. And now that we have a lot more supply, that allows us each week to make much greater headway in this. So I am feeling overall very positive and much more optimistic about the speed at which we can get this done. A lot of the dates and projections I've shared in the past, I was being very careful to not paint too rosy of a picture, and we were projecting things out based on that very slow drip, drip, drip. But if we can continue to open that faucet and get things flowing faster, we'll be able to exponentially increase the speed of this. So that is good news, and I want to thank the state for upping our supply this week. I want to thank the federal government and the whole team doing their work to work with the providers on the supply side. This shows every level really working together, and now we just have to continue this and ramp it up. I know many of you out there are and will continue to be wanting the vaccine immediately, and I absolutely understand that, and I share that sense of urgency. That's how our whole team is operating. So even with all this good news, I have and will continue to press on the request that I did make to Governor Cuomo to have a joint state and county run site here in Ulster County specifically. We don't have that yet, of course, and I think that will be the next critical step to upping our supply even further. So while this is good progress this week with the additional allocation, I will continue to press on this request that I made last week. And to be specific, that's requesting that New York State make our Kingston High School site now a joint county and state site. And I want to thank Senator Hinchey, State Senator Hinchey, and Assemblymember Cahill for joining in that call. I also want to thank all 23 county legislators, Ulster County legislators, for joining in that call. We're all united in this imperative that whatever the supply is coming to the state, we in Ulster County absolutely must have equal and fair access. It shouldn't take our county residents getting in their car and driving many, many hours just to get the vaccine. And I know that that request or that push has been received from the state, but I will not stop asking and pressing until we get more. But I am encouraged that we're starting to see at least some more supply coming to our sites. Once again, as a reminder, if you're watching or you tuned in late or you're just tuning in, we did get a lot more supply this week, over 7,000 doses. The thing you can do to make sure you're getting those updates and ultimately getting information to sign up for an appointment, you can pre-register on our pre-registration list. Once again, that is VACCINATEUlster.com. You can also call a recovery service center. Once you've signed up at Vaccinate Ulster or you've signed up via our phone, the next thing that you should expect, number one, if you just signed up, you'll get a confirmation email saying you're on our pre-registration list. And then please monitor your email carefully because in the coming days, now that we have more supply and as we continue going forward, we'll be sending emails and making phone calls if you don't have email access. We'll be sending that out each day and saying, okay, now you're in the eligible group. Here's some open slots, and then go ahead and sign up. So, for example, about 2 hours ago, we sent an email to several thousand eligible residents in the county, seniors, asking them to sign up. So if you are in that category, if you're a senior and you're on our list, please make sure to check your email, check your spam folder, double check if you're signed up, and you're not getting that, feel free to reach out to us and make sure everything is okay, and we'll do our part to help you there. Once again, we don't have enough supply for everyone, but we have a lot more, and so that is good news, and please make sure you're regularly checking now daily if you're able. Final note on that, we continue, and I continue to be very concerned about homebound seniors and other homebound members of our community. I'm hopeful that on our next update on Thursday, we'll be able to announce more details here. Excuse me. I'm hopeful that we'll be able to announce more details about that, but we are working on a plan to start more actively getting out to our homebound seniors and other homebound members of our community, and that is and will be a priority for us, so hopefully more to come on that Thursday. As we wrap up, I want to thank each of you for joining. I want to thank each of you for hanging in through what's now been almost a year of this incredible challenge. I want to especially thank our frontline workers. My special shout out today is to those several hundred power line crews out there that are making sure that we can all have electricity, that we can have heat and all the things we need in our homes. I want to thank them. They've been doing this work through now several storms and putting themselves at risk. So we appreciate you and all of our frontline workers. On behalf of the 180,000 residents of the county, thank you for what you've been doing. Our next update will be on Thursday at 3 p.m. Hopefully more positive news to share if we each do our part to both check the infection and do all we can for ourselves and our loved ones on vaccines, and we are heading in the right direction. If you need anything, you can always call a recovery service center. We'll put that information up at the end here. And in the meantime, please stay safe and healthy and remain resilient, and I will see you in about 48 hours.